So overall, the findings revealed that service was a prominent concern for all participating families. Across the 3 funding programs, families' ratings of satisfaction with available resources and funds dramatically decreased as available funding did. And as I mentioned, significant differences were also observed across the programs on disability-related support, that domain of quality of life. So this indicates that as funding decreases, caregivers are less satisfied with the support available to assist their child with ASD to succeed at school, work, or at home, or to make friends. With decreased funding, families are also less likely to perceive their relationships with service providers in positive ways. What was really interesting for us was that there was great consistency across the themes that came from the 160 survey participants, as well as the smaller group who we did in-depth interviews with. So as we discussed, although families really appreciated that funding was available, their discussions of service delivery painted quite a discouraging picture of what it is like to access supports within a system that they really described as quite opaque. And one of the most significant concerns that emerged was the prevailing lack of guidance to help families navigate through a very complicated funding system and to choose from many available intervention options, as well as a perceived lack of follow-up. So this lack of guidance was apparent from families' earliest interactions with the service system when they were receiving the diagnosis, and persisted going forward across both school and community contexts. When participants shared their experience of receiving the diagnosis, they talked about this feeling of relief and validation, but again, they were upset by a lack of transition support. And when they shared their perceptions of school and community-based services, this lack of transparency emerged as a predominant theme. So they communicated that it was very difficult to determine what was available, how a particular resource might actually fit with their family's needs and priorities, and then to get a sense of its quality. So a lot of parents talked about this kind of leaping and hoping for the best approach. Overall, they perceived quite a significant mismatch between a service system that emphasizes family choice and autonomy and their experiences actually navigating this system. And in both settings, families desired greater partnering and information sharing. And so, as I mentioned, it was high quality of life participants who were more likely to recount these kinds of positive experiences with service providers who could address, the whole family's needs in very individualized and flexible ways. And they spoke about how this kind of approach really exerted positive effects across the family system and across domains of family life. So this suggests that these kinds of practices that families identified are meaningful, and that they facilitate families' very positive and active engagement with the service system and do help to promote their quality of life. This is in line with previous work that indicates that it's not enough to simply make families responsible for service coordination if they are not also armed with the necessary knowledge and supports. So without this kind of guidance, family-directed service isn't viewed by families as empowering, as we might conclude from the family-centered philosophy, but families instead see it as overwhelming, burdensome, and very time-consuming. So the current findings suggest that in British Columbia, funding services for children with ASD is necessary, but not sufficient to address the individualized and varied needs of affected families. As such, there's significant opportunity for policy revision to better address families' needs. Families identified the need for a service navigator who could help them to learn about the kinds of intervention options that were out there, but also to promote a goodness of fit between the family's needs and what that service could offer. Although it is likely that this kind of service navigator could ease many of the concerns that families raised, I think the fact that families perceive the overall service system as so inflexible is another perhaps separate issue. So families, felt that they couldn't exercise true choice and autonomy if they felt that their capacity to do so was so restricted. Perhaps giving families greater flexibility in how they can allocate funds may foster a sense of empowerment, thus facilitating a view of service coordination as an opportunity rather than an encumbrance or a burden. Caregivers also raised significant concerns about the lack of support that was available once their children reached age 19. And so in the context of BC, participants described that perhaps the adaptive deficit requirement was not reflective of the areas in which their children struggled. And I think Grace mentioned that. Knowing things like IQ score or composite adaptive functioning score doesn't necessarily give you the full picture of what kinds of supports an individual might need. And there is research highlighting that we conducted that highlights the very uneven pattern of adaptive deficit that those with ASD demonstrate, and suggests that we should perhaps rethink using these kinds of composite indicators to make these very large and significant funding decisions. For example, individuals who demonstrate very strong communication skills, for example, may still struggle with more daily living kinds of skills. So things like preparing basic foods, managing money, or even obeying time limits, at work, on breaks. Those individuals may not meet CLBC criteria and therefore won't benefit from vocational training, social resources, or even family support. And it's expected that having appropriate transition supports in place for those across the autism spectrum will better prepare these individuals to find meaningful employment, meet the demands of daily life, and will also ease their reliance on their family. Although I think it's difficult to identify best practices for supporting all families, the principles that emerged in this research that families focused on are quite consistent with the central components of a family-centered philosophy, and thus reaffirm their inclusion in professionals' practice. The fact that so few families actually shared examples of experiencing these kinds of practices is discouraging, but suggests that there could be a disconnect between professionals' understanding and how well they're able to actually implement this within the system that they're working in.